in this. We're still in the COVID, but we're hoping that no one catch infections over here. So my task for the next half an hour or so to share with you about a very emerging data and emerging therapeutics modality of using probiotics in many disorders, and today in the afternoon focusing on the role of probiotics in gut barrier integrity. Now, I think we all know plenty of definition. I know that you have a packed schedule from the morning. I would like to make life very easy. Couple of years that the terminology of the leaky gut or leaky gut syndrome, if you Google that, so by definition is related to the intestinal permeability. In other words, where there is a portions of the epithelium or intestinal wall become leak and easily penetrated by many bad guys, bacteria, microorganisms, or toxin or whatever that insult to our integrity of the intestinal wall. I always mention to this patient using the analogy of along the lining of the intestinal wall, we have to have a good integrity where all these members of SPRM lining up to prevent the breach of the integrity of the intestinal wall, giving rise to toxin penetration, so and so. And the tight junction is very important because intestinal permeability really controlled by them. So the tighter the junction, the least likely that the toxin or bacteria passing by through the wall. So whatever that we eat, let's say just now, that will penetrate, some of them may be toxin, some of them will be absorbed, and these are the toxin that can penetrate through the leaky gut or increase intestinal permeability or passage through the intestinal wall, and these are the guys can initiate the cascade of inflammatory process. The changes of gut microbiota, the ecosystem, the density, the population will change over the time, whatever that we eat. More Western food, for example, we are lack of exercise, and this over time will create the disease as time goes by. And we don't feel that in the beginning, but eventually he or she will suffer the disease. So if I draw this diagram, if you can see the normal area here, where the tight junction is in function, so there is no way a microorganism or toxin can passing by into the bloodstream. But when the inflammation or when this set in, and when there is a gap is compromised or no longer a tight junction is visible, so there will be a chances of many bad guys, microbiota, toxin from the food that we eat, enter that and starting to create a cascade of inflammatory process through the tight junction, which is not tight anymore, which is increased intestinal permeability that we call. So, and this will give rise to many symptoms and signs, mostly related to digestive disorders, bloated, constipation, diarrhea, so and so. I would explain to you more. And who are they? I think we don't go anywhere else. I mean, the simple non-healthy diet or non-healthy lifestyle, severe lacking of exercise, not going to at least 3 times per week or half an hour per session. Of course, heavy alcohol drinkers and really poor choices of diet, which is high in carbohydrate, low in fiber, or very high in the fat, or the sugar or saturated fat, and of course stress. Stress is very difficult to measure. I always ask the patient in clinic how stressed you are, 0 to 10. Yeah, 10 is very stressful, 0 is pretty nothing. So a lot of them, even during COVID, and nowadays the stress level 7 to 8 or 9, even they have to mind their grandchild, also gives a stress, for example. So it's very real things in this life, considering the COVID-19 pandemic too. And of course, these are the part that we call the epigenetic issues, not the genetic or DNA that will never be changed, but epigenetic regulation. That's something that we can catch from the environmental, from induce ourselves in terms of physical activity, diet, and lifestyle, so and so. And what are the symptoms? I think you will see this plenty in practice, ranging of the upper GI or lower GI, bloatedness, constipation, diarrhea, irritability, cranky mood. If you see a patient with constipation, they almost always got cranky mood, a very easy or very sensitive person. They got cramps, they are sleeping at night time is terrible. So these are among the symptoms that we need to recognize early from this patient. Now, asking the patient about the allergic reaction is sometimes very difficult. You know, when they inform you they take nuts or they take this unusual food, they got itchy, scratchy, is it real allergic or not? Sometimes very difficult. So I think we have to be focus many other aspects in daily routine. Sometimes the simple energy level of the individuals, 0 to 10. I think this era, patient would like to have the objectivity, how you assess the patient objectively rather than asking how you are fine, what do you mean by fine? I think quite important. And the other thing that I found out very useful is the sleeping time. So if those who are sleeping less than 5-6 hours or so, and their energy will be very poor, and sometimes they can associate with irritability and a lot of constipation set in and dry skin. Of course, you have to exclude thyroid disorders, but again, these are very important. Fatigability and weakness among the patient. It could be the beginning or early sign of some kind of malabsorption or whatever grade it is, but it's a real phenomenon that we see in clinical practice. And of course, in some degree, patient, we all know for the last 20-30 years or so in this part of the world, there are steady increment of the autoimmune diseases, eczema, asthma, and they're also responsible to the changing or shift paradigm of the gut microbiota in our bodies, which is changing from day to day because they are very dynamic. And of course, they are among the microorganisms that really challenge the integrity of our gut intestinal permeability, especially the lifestyle is not so good. Now, what are the causes of this? I mean, leaky gut, if you Google, there are many big shot, quickly, all these people who are doing the research many years, it's very difficult to diagnose. And there's no blood test or anything to say that, oh, this guy has a leaky gut syndrome, for example. They are not like irritable bowel syndrome, where you can see, we can follow Rome 3 or 4 criteria, or inflammatory bowel disease or eczema. But the leaky gut syndrome, still, there is no definitive diagnosis and still under intensive in the research arena. And of course, there are, I'm not going to repeat many things. This again, with regards to our poor lifestyles, a diet extremely poor, low fiber. On average, as a Malaysian, many studies have shown that usually the recommended daily allowance for fibers is about 20 grams per day. So if I want to equate with the apples, it's about 12 to 13 pieces of apple per day. You tell me, who are the Malaysian eating 13 apples per day? No way, right? So the average Malaysian taking the fiber is about 8 to 10 grams. And no wonder colon cancer is the first cancer for Malaysian men and the second for Malaysian women. And it is estimated over the next coming of years that the colon cancer will become number 1 for women too. So the fiber aspect, we take in high fat food. Fast food is a business entity, of course, and those who can drink alcohol, you have to look at the limit 14 or 21 units for male and female respectively. And also exercise. Of course, before this we can blame COVID, we cannot go exercise. Now we cannot blame anything else. So we have to go to the open spaces and try to walk whatever to achieve whatever step, 10,000 steps per day or 30 or 45 minutes per session, so that you can get a good quality of physical activity. And again, stress is very difficult. I think a very common patient nowadays, regardless of the age, when you speak one-to-one, you're asking about how's the mood department. I always ask them, how your mood department, so you want to put in a way that the patient will not be annoying, or the patient will not be stigmatized by you. So you have to be have a skills and how things at home, so and so, and in fact they want to see you and you become a counselor for them actually. There's nothing wrong. It's just want to share the instability of the mental health, or the getting irritability from whatever condition may begins from the gut, for example. And of course, we all know from the National Health Mobility Surveys, plenty of diabetes around. You all manage them very well. Obesity, dyslipidemia, hypertension is one of the alarming diseases in Malaysia, in the world, if I put in the ranking. So something that not actually healthy for all of us. And it's quite common, patients who come to my GI clinics, this patient may be prescribed with the multiple courses of antibiotics. I think we really have to think before prescribing antibiotics if these patients has bacterial infection. If they are only viral infections, I think we should not, or I say we must not give antibiotic for this patient, because they just wipe out, kill all the, not only the bad guys, but more importantly, the good guys, the good microorganism in the digestive tract, which is more than 200 trillions of different microbiota and the bacteria, fungi, algae, and virus, so and so. Because they have play a very important role for us to optimally digest the food, vitamin, kind of metabolism, and also immune system regulation. I think we all know the second brain, so-called, is actually in digestive tract, because 70% of the immune system is actually located in the digestive tract. So it's a so-called second brain. So it's quite important that if we decide to commit to use antibiotics, whether your favorite is metronidazole or ciprofloxacin or so and so, I think we have to be very careful, because we do not want to create resistance in the future for our patient, because the increasing resistance among Malaysian patients is really emerging data in many studies at this moment of time. And of course, if you look at, I don't want to bore you in terms of very scientific things like the molecule or the protein called zonulin that we're interested in, the type of protein that is a major regulator that play a key roles in the intestinal permeability, how leak is the intestine of the individuals. And the zonulin is the protein where they can bind to over here around across the tight junction, and when they bind, they just open like a bridge, or open like a passage to the, or a way or a road map to the bacteria to passing through this not longer a tight junction anymore. And as a result of that, there are massive translocations of microorganism, bacteria, virus through this across the tight junction, and then the symptom will set in over the time. So someone actually have intestinal permeability is compromised, then these cross a lot of toxin and protein were passing through that. And of course, the two factors that triggers the protein, the zonulin, I won't go into the gluten, because gluten-free diet we use for the celiac disease, which is actually may not be happening celiac disease in Malaysia. Mostly where I practiced before in the west of Highland, we have about 1/300 patients with gluten issues, mostly celiac disease. They responded very well with a gluten-free diet. But more important factors in this part of the world is bacteria in our intestine. So these factors actually trigger the release of the zonulin. And at this moment of time, in practice, we don't measure that in our blood or in our secretion. So this is still in the research arena. So as I said to you early on, when the zonulin bind to the lining or the receptors over here, the tight junction no longer tight, so there is chances of the bacteria and whatever microorganism, whatever food that we eat, which is not clean, so and so, passing here and starting to create all these inflammations in the beginning, very low grade, and over the time can cause more problematic my patients presented various symptoms of digestive disorders. So the question is how we tackle this, what we call this leaky or intestinal permeability. I think this is a very straightforward dietary lifestyle. If you use the app My Nutri Diary 2, if you Google the apps, My Nutri Diary 2 is a design formulation. I always use that to tell the patient to go there, to tell that teh tarik is about 125 kilocalories and teh o is 20 kilocalories. You know, and if you take, because sometimes we don't know what are the kilocalories that we eat. Okay, we go by how tasty the food, is fair enough. But I think for those who get, for example, fatty liver, dietary manipulation is very important. And then simple, not using the app very regularly. You use 2 to 3 weeks, then you know already which part of the food that really high. For example, the favorite one, the chicken rice shop, you know, so that's about nearly 545 kilocalories. So you imagine that's probably more than nearly 30% of the 24-hour kilocalorie intake. And when you tell this patient and they follow that religiously, you can see their carbohydrate intake will be reduced, their protein intake will be high, their leafy vegetable will be good, and of course I think you're familiar with quarter and a half as well of the what we call this for healthy diet. We also do a study now in UKM. We want to measure how healthy is the lecturers and all the stuff in UKM. We give the smartphone and the smartwatch we design, and we record their sleeping, we record their blood pressure, we record their diabetes, and there will be someone or robot or this chatbot that will send a message to the individual if you are eating too much or if your diet is not good. Another thing about diet is chronotropic or the time of eating. Some people would like to have a dinner early, which is very good. Some people in Pakistan, if you go to meeting, they have a dinner at 9 and they finish at 11:30 p.m. But the food is delicious, you know. So I think we have to compromise on that. And high fiber diet is very important. Thousands of studies proven to reduce the colon cancer in whatever individuals. And they limit the use of NSAIDs, but of course if your patient required for the arthritis, why not? But limit the use of antibiotics, and also the practicality eating fermented food and also probiotics, which is by definition by World Gastroenterology Organization is a live microorganism that you take in certain portion will give you health benefit. I'll give you more detail after this. So the one that we interested for the last couple of years is MCP BCMC strain, which is we have you can see here 3 types of lactobacillus and 3 types of bifidobacterium, and how these transform into the clinical practice. You know, we don't I think all of you are familiar, testimonial is not actually in the pyramid of the evidence-based medicine. On the top of that pyramid is meta-analysis, which is analysis of many studies, and just below it is a randomized clinical trial. So in God we trust, the rest in the data. Testimonial can be not true at all. It can be even the medication like Panadol, paracetamol, it has been in the market for years, but before the study intensively and has to be proven benefit and undergo certain regulations, good manufacturing product, for example, and many series, so that the data will be validated and confident for all of us to use. Now, so how does this, for example, BCMC strain help for many to improve the GI disease? We have done the studies. Patient for irritable bowel syndrome or chronic constipation, there's an increment of 50% as to frequency in patient with constipation. So every second patient that we observe, the complaint of the constipation it disappear. Not only that, I also collaborate with our neurologist, Professor Dr. Nolina, about how a lot of Parkinson patients, we know that their mortality of the gut is not that good, but they got a lot of constipation. we try lactulose, you can go fibrogel, you can go Folex or whatever your favorite things, or Senocot. And Senocot do cause some cramp among your patient. So we also do clinical studies, clinical trial, and in fact, we see a dramatic improvement of constipation symptoms among the Parkinson patient. And also the opposite symptoms, which is diarrhea. For those who get irritable bowel syndrome, diarrhea predominant, we also observe remarkable improvement of the diarrhea things for the patient. And ultimately, when we install the probiotics, giving the good life microorganism to repopulate the good bacteria that were missing from whatever lifestyle that we're doing, to get the ratio of the good bacteria higher than the bad microbiota. And this ultimately would improve the barrier integrity of the lining of the intestine, and automatically we improve the nutrients absorptions, and also healing process or recovery of the damage or the intestinal permeability that I described you early on. And on the top of that, the other benefit that we observe is also improve the immunity or immune system. I show you the studies. There's a measuring of few cytokine or protein that we do in the blood, even in the setting of patient having cancer, for example. They also reduce remarkably the few cytokine key players like TNF-alpha, interleukin-6 in this patient after consuming probiotics or BCMC strain. And we also done in studies in the diabetes with Prof. Noazmi last time, and it shows that the HbA1c can be reduced, and the management of that is better. I think many years ago, many of you knows that there are only few anti-diabetic medication, metformin, glucophage, damicron, but now is a very specific. There are about, 20 over oral hypoglycemic agent, some of them renal protective, cardioprotective, or so and so. So I think the role of probiotic also been proven by the research that we do. This is, for example, patients who get constipation. Again, a randomized double-blind placebo-controlled trial that we observed that a good reduction of the patient with the constipation, and of course half of the patient demonstrate increased the frequency from the baseline. And we also look at this with Dr. Nohayati, the palliative care specialist. We all know the patient who have many diseases. They take a lot of painkillers, and constipation is very common among them. And many of the medication use not improving. So I throw this idea to her. We got a master student, and we evaluate the efficacy of the probiotics or this BCMC strain in terms of alleviating constipation. And true enough, again, another half of the patient really improved the consistency of from the Bristol type 1 or 2 into the lower one, and also very important overall, 70% have demonstrating the improvement of the constipation. And these are the study that I did with Professor Nolina using the Bio in terms of improving constipation. Again, as I mentioned to you, Leon, the transit time is reduced significantly over a third of the cases, and as you compare the placebo, the use of the BCMC strain is really help for the patient of the Parkinson with constipation. Now, you wonder how does this work scientifically? So you can see here BCMC strain produces a BSH or bile salt hydrolase, and these bile salt deconjugated into the primary bile acid by BSH, and it binds to certain receptors, TGR5, and this trigger the water influx into the intestine, because the role of the large intestine to reabsorb the water. And when the trigger of the water influx into the intestine, then the bowel motility is improved and stimulating all this defecative process, and the patient can improve from the constipation. As very simple as that. No adverse effect so far, and it's very good, useful in clinical practice. And also the study by Prof. Kim Fachim before in the Simlaya look at the strain specific in this the same package of the inflammatory markers in patients with colon cancer in terms of controlling diarrhea. As you can see here, after the intervention as compared to placebo, the diarrhea is improving after consuming this probiotic. Again, the concept for how this BCMC tackle in the diarrhea, again quite straightforward, but this time the FSR receptor is involved as opposed to TGR5 early on in constipation, and these potentially neutralize a lot of toxin and really suppress the inflammatory chemokine, cytokine that involved in diarrhea. As a result, stool will be solidified and the diarrhea is improved. Now, Dr. Najmi, my specialist, now qualified gastroenterologist, I also throw the idea, why don't we look at the gut health integrity in patient with fatty liver, which is very common again. As you can see here, when we do this very complex study, I'm not going to bore you, and suffice to say that the highlight here that probiotics has helped to stabilize the mucosa immune function. When we look at some expression, in this case CD8, where the expression was reduced as in the placebo group, but not in the probiotic group, suggesting that the role of probiotics rarely involved in the intestinal permeability or in the tight junction, the one that you mentioned early on. So there's a role, a gut and liver exists. If you believe that all the disease arises from the gut, and how we're going to manipulate in the future by giving the probiotics, installing or normalize the fatty liver or NAFL, non-alcoholic fatty liver. The right terminology now for the last year and a half we call MAFL, metabolic associated fatty liver become NAFL become MAFL, just to make things interesting, I suppose. And also we can see the clear reduction of the how the BCMC has biostabilized the mucosa immune function in the CD8. This is kind of our master student doing in the lab, which is a really exciting result, how this modulation of the gut microbiota, such as BCMC strain, stabilize the expression of zonulin, a protein that I mentioned you earlier on, involved in the tight junction in the intestinal permeability. Again, probiotic also involved in terms of giving rise to a lot of production of the short-chain fatty acid, for example, and it shows improve the immune system, and we have several studies for that. And then you can see also we need good bacteria in our digestive system, because the good bacteria leading to good production of the short-chain fatty acid. There are three most essential: propionic acid, butyric acid, and these are the guys that involve a lot in metabolism, vitamin, immune response, digestive system, so and so. And these are the guys that we need to get more. We can actually measure them. We call it using omics or metabolomics. We can measure the short-chain fatty acid, but we don't do that in routine practice because they are very expensive. We do that at the research level, and a lot of research, not only on our side, also the rest of the world, shows the benefit, and they ultimately reduce the inflammation. Now, these are one of the studies, again, in the colleagues in the University of Malaya Medical Center, how the barrier integrity can be modulated, can be manipulated by using BCMC strain, where a third of the patient can have a normalized function of their gut after the surgery, and half of them can be discharged much earlier after the care of the surgery, and a lot of them, a third, also discharged from the ICU, and just more than half of them return to a normal gut flora. So something that we actually look at the molecular level, not just at the clinical level, for the use of the probiotics. And again, Liana, my student, finished with us. We also brave to employ to do randomized double-blind placebo-controlled trial using BCMC again in patient who has colon cancer and has been treated with chemoradiotherapy. And we are very excited. We were not expected these results. What you can see at the bottom here, that there are more than 60% reduction of all these cytokine. I don't want to mention you, TNF-alpha, interleukin, various. These are involved. They are bad guys. They are pro-inflammatory cytokine. So they are very high. So if I measure those cytokine in your blood, maybe half of you has slightly elevated level, because they can influence with age, they can influence with the body weight, they can influence whether you're a smoker, and they are not good. but because of the level is still low, that's why patients do not have a symptom. So you can imagine how the manipulation by the probiotics in the patient with colon cancer, and obviously they have a very high the inflammatory markers, and how they can suppress those important key players as a cytokine or inflammatory markers. And they can function, as we can put terminology, as the immunobiotics. So that means how they modulate the immune system. And this is very important data, and we have published this, and we are surprised, and we also scared in the beginning, because someone who get the cancer, got chemo, radio, you're going to give live microorganism. So there's a potential, people might say sepsis, but there's no data actually. So none of the patient got adverse effect or septicemia. So it's really an eye-opening to our gut research group, and we're hoping to do more, a big number of patients. You can see here, patient that we when introduced a PMC strain, Hexabio, all these important players, TNF-alpha, interleukin 10, 12, 70A, 70C, and these are reduced remarkably in the patient after consuming Hexabio or MCMC twice a day for 6 months. But what we have not done, and we learned the lesson, is we did not record the patient, because purposely we don't do that, after 6 months when they finish this, to remeasure again, so that to show that they actually dependent on the probiotics for certain duration rather than just 6 months, because we don't know how long that we're going to recommend this patient taking probiotics. So something that we can look in the future, but this study really excited many investigators in Europe, in Japan, and in the US, how we can do this, and we got an excellent result, and they asked us in terms of many other aspects of precautions, so and so adverse effect we reported in the full paper. And also a diabetes point of view, Prof. Nazmi Kamaruddin, he's retired now, also do a study using the BCMC as well, and how this also potentially can reduce HbA1c levels and reduce the fasting insulin levels, and ultimately also has some renal protective or protection against the kidney. So, ladies and gentlemen, I think leaky gut syndrome or leaky gut digestive, probably first time you heard, probably something that we have not discovered, but we are opening the black box, we are starting to explore further, and one of the ways that we can tackle this intestinal permeability or tight junction that giving rise to a lot of digestive disorders by manipulate our gut microbiota, by using selective the right choice of the probiotics. In all the studies that have been published done selectively, we use a PCMC strain, and we have proved that, and we published that. So I also introduce the ebook. Those of you can download this about all this information and the probiotics, and you also can get hard copies over the booth, and I do hope everybody can